Welcome back, everyone. Welcome back. So those videos were amazing. Every time I look at them, I'm so proud of the accelerator cohort that we had that produced them. Well, my name again is Brigitte Corbin. I am the Executive Vice President of Wilco Electronic Systems, as well as the founder of Mogulette. And I'm very, very proud to welcome you all to the Women in Tech Soiree Launch Lane Showcase, hosted by Venture Café Philadelphia in partnership with the Science Center of Philadelphia, our Science Center University. And we just want to thank you again for taking the time. I don't know how many of you were just listening to panel number 1, but it was fantastic. And, you know, we're kind of on a roll right now, but we're really excited for this next group of speakers and presenters. Just a little housekeeping real quick. There are some few technical options for those who are attending. If you need to take your mouse or tap to the bottom of the screen, that will open up a menu of options. The microphone and the camera icons will definitely mute or unmute your microphone. And definitely we are totally open for questions, and I'm sure there'll be many. So if you do have one, feel free to go down to your chat box. We are monitoring it very closely, and I will get all of them and I will pass them on to our moderator. And definitely they'll be answered in the order that they are received, or we'll definitely roll them in as the conversation is coming up. But to note, again, without further ado, however, we are very excited to now welcome our Launch Lane panel. And why I'm really excited is because I get to introduce Tiffany Wilson, who I just met. And I kind of really like her, you know, like I love her story. I love her background. I'm so glad we had a chance to really meet just as a person. She's Atlanta. You know, we knew the same places and restaurants. I went to Spelman, so we had a great chat, but her vision is so on point. And I'm so excited for her leadership as the new CEO of the Science Center. So just a little background about Tiffany. She brings more than 18 years of leadership, transitioning innovative medical technologies from benchtop to bedside. I love that phrase. Building partnerships across academia, industry, and economic development organizations. She most recently served as the CEO of the Global Center for Medical Innovation, an Atlanta-based nonprofit dedicated to supporting the development and commercialization of innovative medical products. Her background is in medical devices. I'm sure you're hearing this, right? This commitment to fostering innovation and understanding of business strategies that's propelling her leadership into the Southeast, particularly around this spotlight. You know, when we talked, what I loved is she understood telemedicine's accelerating. The products, the hardware are going to be a part of this decade of marked by the pandemic. And the fact that she was literally Becker Hospital's review of the 110 women in medtech to know in 2017, like we have the right person for the job, not the right woman, but the right person to lead the Science Center. So I'm excited because a lot of people are still getting to know her. She's still in transition to move physically to Philadelphia, but her Atlanta roots, and you'll be able to share that with Jewel, because Jewel actually also is in Atlanta, Tiffany. So hopefully you guys can maybe even have your own conversation around that. But we're so thankful that you're able to join us. And we're so thankful that you're able to really welcome and introduce the Launch Lane inaugural cohort number 1. So everyone, Tiffany Wilson.
Thank you. And thank you for the warm welcome. I'm super excited about Launch Lane. So good evening, everyone. I hope you've been enjoying the fantastic program today. As Brigitte mentioned, I'm Tiffany Wilson, the new president and CEO of the University City Science Center. We're absolutely delighted to be part of the Women in Tech Soiree and Launch Lane Showcase, which is brought to you today through our Venture Café platform. The pitches you just saw and the companies you're about to hear from are our current Launch Lane Accelerator cohort. And so just to give you a little bit of background, you know, Launch Lane is designed to support companies developing tech and tech-enabled startups as they transition from the prototype to sales and then customer acquisition. Our accelerator uses a blind application process to debias the selection. And this is a proven methodology that has resulted in over half of our participants across 4 cohorts being women or minority led, with a success rate unmatched by any other accelerator, which is has always been for me. It kept me so engaged with the Launch Lane and just excited about the opportunity moving forward. So there's 27 of the current and past Launch Lane participants that have gone on to raise more than $100 million in follow-on rounds and generated over $50 million in revenue. You just saw our cohorts videos, and now you're going to have a chance to see them live in a panel discussion moderated by none other than the head of Google for Startups, Burks Solomon. And so, Brigitte, I'll pass the virtual mic back to you, who will introduce Jewel, and I can't wait to meet in person next year.
Absolutely. So I think we're now about to go to our speaker view, and I guess we can probably even take down this slide. But Jewel, hi.
Oh, how are you?
How are you? I remember meeting the first time at a South by Southwest conference, which I'm actually missing being able to actually go and meet in Austin, because when you go to the conferences, this is what virtual will never do. You get to run into Burks Solomon and say, hey, Jewel, I don't know you, you don't know me, but I love your work. And I think I said that, and I got her email, and I've been in contact with her and mutual friends. But when she said yes to this event, it was kind of like the highlight of the year, really. She's kind of doing her thing across like many platforms, and we're happy to have her here, particularly because she's also coming from Atlanta. So I really hope you at some point get a chance to connect with Tiffany Wilson. You two probably crossed paths. But just to introduce Jewel formally, she is the head of Google for Startups in the US. And in this role, Jewel works to level the playing field for underrepresented startup founders and communities by connecting them with the best of Google's products, people, and platforms. In addition to this role, she also serves as the managing partner of Collab Capital, which is an alternative investment fund that she launched to close the funding gap for Black entrepreneurs. And her mission really is about creating more access to the technology innovation ecosystem. That's her history, that's who she is, it's in her DNA. And prior to even coming to Google for Startups and Collab Capital though, which is when I started to know more about Jewel, she was founder and CEO of PartPick, which was a startup that was acquired by Amazon in 2016. Again, it was a startup that was acquired by Amazon in 2016, and which streamlined the purchase of maintenance and repair parts using computer vision technology. And after even the acquisition of PartPick, she became a product leader at Amazon's visual search and AR team. She led the integration of their technology and launched its Amazon Part Finder in 2018 to over 150 million users of Amazon's mobile shopping app. Burks Solomon is here in Philadelphia. We're very excited. Jewel, thank you so much. And I know you have a big task in front of you. You have 7 of the best entrepreneurs I've met in a very long time. They've been waiting for this moment for a year. They've been working very hard. I'm gonna hand it over to you. I'll still be here. If there's questions, I may either just like raise my hand or take them, or I can either email them or text you, but definitely, you know, we're kind of you have us in your hands. So whatever you need from us, but we're very excited to have you join us. Thank you so much.
Thank you so much for having me. I'm super excited to, at least for a night virtually,
I know.
in Philly. Really thrilled to see you all. I loved watching the videos of you all's companies. I see that you've been doing phenomenal work. So it's really an honor for me to be able to moderate this discussion. And I want to welcome everyone to the panel. And I also want to make sure the audience, you guys feel free to put questions in the chat. I am here as a servant to you all and making sure that we get all of the information from these incredible companies. So please feel free to add your questions as we have this conversation. But to kick it off, as we're bringing people up, I want to start off with the origin stories. So one of the things that I think is most interesting about startup founders is kind of that first moment that you said, okay, this is what I'm going to spend my time on. This is what I'm going to spend years on. So I want to dig into that for each of you, and we'll kind of just do round robin. And Crystal, we're going to start with you because I've had a chance to meet you in person when we were together in February at HBS, and you won the pitch competition. So I'd love to hear from you the origin story, and then I'll take a moment of personal privilege and want to hear how things have been going since we were together in February.
Awesome. Well, thank you so much, Jewel. It's so nice to talk to you again. Thank you for honoring us with your presence. This is great. So Again, my name is Evuleocha. I'm CEO and co-founder of Cura Health. We're a digital health company on a mission to increase access to health resources for young women, specifically starting with colleges and universities. So as Joel mentioned, we kind of, we've gone through an evolution, and I'll kind of go through like why I started the company. So I'm an immigrant. I'm originally from Nigeria. So I moved to US in 2010 for college. And while I was in college, coming from a super conservative background, didn't quite have a lot of introduction into like women's health or even issues around health in general, feeling uncomfortable speaking about these things. I relied very heavily on the internet for answers to my health questions. One time I felt extreme pain in my abdominal region, tried to book a visit at my campus health center, but as soon as I hit a roadblock, I went back to the infamous, as you all might know, Dr. Google. I started Googling all my symptoms and settled for period cramps. Now, fast forward to a few days after, I felt extreme pain. I actually passed out and was rushed to the hospital for emergency surgery on a very different condition from everything I found online. This being a very scary experience, of course, for me, being a young independent adult in a different country and going through this all by myself, led me to really think about, what are the ways using technology we can increase access, one, by connecting young women to trusted experts, but also doing it in a way that, provides them with a high level of comfort and confidentiality to be able to properly seek professional medical advice instead of relying on the internet. So that is my story. And as far as the evolution, so when I met Jewel a couple of months ago, we were actually called Clit Health, so KLIIT. Clit Health stands for the clitoris, for anyone who's thinking, what does that stand for? And the whole purpose of that, of course, was to, start a real conversation around women's health issues and to destigmatize the conversations about these things. And, we've made some progress, going from Clit Health. Now we, did a total rebrand, as far as adding mental health resources as well as primary health care to the offerings that we have. So we rebranded up over to Kira. And now we're a full-blown telemedicine company providing both video, phone, and chat functionalities versus where we were a couple of months ago providing health educational information alone. So that has been kind of the evolution, just going, towards telemedicine and being able to really, impact change. So.
Amazing. Thank you for sharing that, Crystal.
For sure.
Brandon, I'm gonna go to you next. You're next on my screen, but also I want to hear about the origin story for ARC. So can you share a little bit about that?
Yeah, so I'm Brandon. I'm the CEO of ARC Aeronautics. My two co-founders, Sherman and John, are here. And our mission is to connect first responders to the information that they need to save your life when you dial 911. And each one of the co-founders at ARC has gone through our own traumatic events in our own way that have really shaped our perspective on the fragility of life. And we realize that despite the best efforts of first responders, sometimes they just don't have the information or the time that they need to get to you. And Sherman lives this every day as an active firefighter and EMT. And so let's just put this into perspective. Every adult in America is going to dial 911 at least once a year on average, 700,000 people a day. And it's leading to these insane response times, not because first responders are lazy, but because it's just not, it's almost impossible for them to get you in time. And the core thing that we're solving for is two things. One is the speed in which they arrive at the scene, and then the information that they have when they get there. And so our platform has been designed to help solve that problem, and would love to talk more about that. But that's our origin story. Is Sherman lives this every day. John and I have dialed 911, and that really inspired us to found ARC.
Thank you for sharing. I had an opportunity through a leadership program, to sit in on the 911 dispatch and watch and take some of the calls. And I will say that was probably the most nerve-wracking experience of my life. So if you're helping to make that easier, that's great. Let's go to Jessie. I'm gonna come to you next. Can you talk a bit about what was that sort of spark, or what was it that led you to your company?
Well, hi, everyone. I'm Jessie Garcia. I'm the CEO and founder of Tizuda, where we design and manufacture a head impact indicator for concussion awareness. So it's a device that attaches to the back of any helmet or hard hat and will turn from clear to red if you get hit at a dangerous force level. So all you have to remember is if it's red, check your head. So I started this company because I was a rugby player at Lehigh University. My coach didn't recognize that I had a concussion and she let me keep playing. And because of it, I got hit again. And I suffered from post-concussive symptoms for about 6 months afterwards. And when I went to look for a product on the market, Jewel, like the only thing available was a $300 mouth guard at the time. And frankly, I went through like 4 mouth guards a season. So it was just really unaffordable and accessible as a college student. So that's why I was like, all right, there has to be a simpler way to do this or a more affordable way. So I went back to school. I got a master's in engineering and started Tizuda because of it.
These origin stories are so incredible. Like, not incredible that you got a concussion and your coach didn't recognize it, but incredible as far as the discovery that it led you to and in this kind of path that you're on. So I'm really, really excited to hear that. And thank you for sharing, Jessie. Rob, let's go to you next. What was the kind of spark that led you to Envoy?
Well, thank you, Jewel, for having us here today. I am the co-founder and CEO of Envoy at Home, and my name is Rob Blatt. Envoy at Home is a digital caregiving service that transforms the price of care from $25 an hour to 25 cents an hour to keep seniors living independently longer. The origin story is actually very personal. I found myself as a family caregiver when I lost my dad a few years ago, and my mom was living by herself 1,500 miles away. I'm here in New Jersey. She's down in Florida, and we have a sister in Chicago. And so, what does a family do? How do you care for a loved one when you can't be there? So being the dutiful son that I am, I looked around for some solutions, and coming from a background in technology, there really wasn't anything that was available to us that certainly met our needs as distant, remote family caregivers. So we launched Envoy at Home to solve that very need. How do you provide the tools and resources to caregivers who can't be with their loved ones all the time? We initially thought of this as a direct-to-consumer kind of experience, but along the way and through some work we did with the Penn Innovation Center, we realized that working with other care managers is something that's very important to the caregiving experience. Caregiving is still a very personal experience, and it's, for the most part, has always been a high touch experience. And so while we wanted to bring in a high tech component to it, we recognize that there needs to be a balance, and how do you achieve that balance and so forth. So we launched a business that allows caregivers to work with a care team and being able to remotely support their loved ones and keep them living independently longer.
Nice.
Rob, I appreciate you sharing, and I know it may be even painful to share and relive the origin story, so I really appreciate you being vulnerable with us and sharing that. Mm-hmm. One question I have for you, going off of what you shared, is in this wild and crazy year that we've had of 2020, where there are, I'm assuming, a lot more people that are in a position of having to be caregivers. I'm curious what that's done for your business. Mm.
Yeah, it's I think it's accelerated the idea of adopting technology for caregiving, probably by at least 5 years. I think the consumers have wanted the use of technology, but they weren't willing to, they really didn't know how to find it, quite frankly. And so I think that COVID has really accelerated consumers' perceptions and adoptions of technology by many, many years. And that's been very helpful. The converse, of course, is that we initially had to reshift some of our business priorities and plans because we gather data using some inexpensive sensors in the home that work with smart home. And so how do we get people to do this themselves? where the data can be easily gathered. And so we had to rethink our approach to our business and our go-to-market strategy. But fundamentally, if there's been a silver lining, I hate to even use those words in the age of a pandemic, but it really has been around the idea of everything is now telehealth, remote health, and all of these ideas around remote and distance and virtual have actually helped people understand that solutions that are support that process can be very effective and can dramatically lower cost, and quite frankly can make it more accessible. So COVID is actually very interesting, right? When there's an illness, people want to get together and you want to be with your loved one, and so there's this paradox, particularly with COVID, in that it has forced us to stay apart. And so we're sort of trying to navigate that by trying to bring people together virtually so they at least can provide the essential caregiving that's so vitally needed for seniors and across our country.
Awesome, thank you. Amberlee, I'm really excited to hear about the origin story for your product. Can you share a bit about how you got the idea and kind of how you brought it to market?
Sure, I'm okay. Hi, I'm Amberlee. I'm the CEO and co-founder of Pippy Sips. We've created the first ever award-winning all-in-one storing, cooling, and monitoring system for breast milk. Women use 25% of their body's energy to make breast milk, and Maya ensures that 100% of that liquid gold is kept safe. So the story of Maya is super personal. I have a 4-year-old now, almost 5-year-old. So it's been about 4 years ago that I was running a mental health clinic here in the inner city of Philadelphia, really as the opiate epidemic started to peak. So as you can imagine, there was all sorts of crises happening, people coming in psychotic, people coming in withdrawing from opiates. And it was my job really to make sure that everybody left the building safely. And that involved a lot of talking to therapists, talking to psychiatrists, de-escalating individuals coming in. And in between all of that, I was pumping breast milk so that I could bring breast milk home to my baby every day. Mm-hmm. So as you can imagine, pumping is the pits, as I said in my video, but it's even worse when you're in a high impact job doing direct care work, mm-hmm. and people really need you. So there was a couple things that were really confounding to me as a pumping mom. So number one, the fridge that I needed to use was in the room where we did group therapy. So that was pretty uncomfortable. I didn't like to knock on the door, obviously, when people are sharing their innermost feelings and thoughts and trying to get better. And then the second thing was really that the option for cooling outside of that was a cooler that involved many pieces, was bulky, would leak, wasn't always dependable. And quite frankly, I wasn't sleeping at night, so I was always forgetting parts of that numerous part system. And kind of in a day of pure insanity, I was sitting there. I hadn't been able to get to the fridge. I didn't have all the pieces for my cooler. And I looked at my Swell water bottle and I thought, like, why don't we have something like this for breast milk? You know, women, we deserve better. We're out here working and we're just trying to get through the day. So anything to make it better. And that really started the journey for me, mm-hmm. and where we're at now.
Well, I'm sure moms everywhere are so grateful that you had that mm-hmm. epiphany and really set out to build your product. So thank you. T, I see you're getting love in the chat. So we're going to come to you next. Tell us about what was the origin? Why did you start your business?
Hi, I'm Tywanna Carter, the founder of the OraVac, and that is short for the oral vacuum. I created it for my mother. Unfortunately, she had a stroke and left her partially paralyzed. And I visit on Sunday. She's in a full care nursing facility, and her one joy is to get outside food. But when she went to go eat it, she was coughing so violently. I mean, at one point, actual blood came up. And I thought, don't you have at least that little thing that the dentist put in your mouth when you're at the dentist that can suction out the extra saliva? And they said no. And I thought, oh, this is ridiculous. I'm sure I can find something on the internet. Went and searched and found plenty of suction devices, but none of them was something that she could use. Remember, she's partially paralyzed, so she only has the use of the one arm. And it needed to be something that she could change on her own without having to ask for the nursing staff to help her. So when I couldn't find it, I made it, and it was hilarious. Going into restaurants, it literally sounded like someone was starting the lawnmower in restaurants when she was using the first one, but it worked. It solved the problem for her. She was able to then eat her food, and she does it in such a way that she finagles and suctions out her extra saliva, and then she can chew and swallow the food that she wants the food. She has a condition I've learned through research called mixed consistency. And a lot of people with strokes and that have dysphagia as a result of a stroke or another neurological or neuromuscular condition have this condition, and it's a permanent part of their life. And we found that the medical community, and thank goodness my competitors, they focus on the actual medical condition that causes it. No one is really looking at the actual drooling and the actual buildup of the saliva. I also found out that people die from that. You can have silent aspiration, pneumonia. My mother had a constant rattle in her chest, which lung infections and bronchitis and just myriads of other things. But that's how I started it. It was out of a need.
Wow.
I know spit's not fun.
I was sitting, I'm like, I need to remember to breathe, because you all's stories are just, they are so inspirational. So I really appreciate you sharing. Burak, I want to come to you next, and keep me honest on pronunciation.
Hi, it's perfect. It's like Obama. It's really similar to the pronunciation. So hi again. I'm really happy to meet you virtually. It is a great honor. I'm Burak Ozkosem. I'm the founder and the CEO of Paralabs. We're a full stack life sciences company. I just put this together. So we have software, hardware, and services provided in a way. Our whole goal is to select the better sperm for better future. That's all it is there. It sounds simple. All the way going back to my PhD at McGill University, working on sperm biology for several years. We just work with really old school. The newest technology we used was microscope. All these things you hear with the COVID-19 right now, all the PCRs and everything. The most of the new technology, it's not really accepted in the reproductive medicine yet. It's a very conservative, the field, and especially the fertility part is very, taboo. And just like on the social aspect of it, it creates a terrible psychological and economical burden on the couples. So that's how I quit the ivory tower and then start the company. And so we are very excited to help couples to shorten the IVF treatment so they can have a child in a shorter time, especially considering that the COVID shut down fertility clinics for 5 months globally. Imagine that you have to wait for to have a child, and all this, the injections and the therapies and everything is delayed. So there's the waiting list right now for the IVF treatments. So our goal is to help couples to, conceive a child and have a family. Thank you.
Thank you so much for sharing. It's probably an overshare on my part, but I'm right now in the throes of dealing with exactly what you're talking about. So I can attest to the fact that it's been super tough to get appointments, and just a big strain around this fertility issue. So I appreciate the work that you're doing, and I'm like on your website right now, like, okay, I need to figure out how can you help me? So I really appreciate this. So thank you all. I'm like completely blown away by the stories, by what's compelled you to do this work. And I really wanted to start there because I think it's so important. First of all, entrepreneurship is so hard. And to be building businesses in a global pandemic, super hard. So I think it's just important to know, why is it that you're doing this? What is it that's compelling you every single day to wake up and keep going? So really appreciate you all for sharing those origin stories. I want to talk a little bit. There are a few of you who have physical products, and I'm curious about the iteration process. I heard in a few of your origin stories that, you did the first one and maybe it was a little rough, but it worked. So I want to hear about what's been the process to get your products to where they are today. And maybe Amberlee, we can start with you on that one.
Thank you, Jewel. You must have read my mind when I was thinking of the many iterations that we've been through in this 4 years. I'll be quite frank. The first iteration was me actually pumping into a Hydro Flask water bottle. So a stainless steel water bottle. That was really the original intent with this product, was stainless steel keeps things cold. It keeps things cold for a long time. So it really started there. And so we have been through many iterations. For those of you who follow us on social media, you can actually see a lot of iterations. We had some even funny designs where it was in the shape of like a cat, and it was more directed at the baby. And we quickly realized that this product was really meant for mom. We didn't want a product that had like Mickey Mouse or Minnie Mouse on it. It was really something sleek and beautiful for mom to feel good about. So my co-founder and also husband, who's probably watching with the kids right now, will probably kill me, but we are pretty much done with iterations. We have come very far. We had to do a couple iterations most recently as we get ready to manufacture. One thing that I didn't know as somebody who's not an engineer is that you can dream something beautiful and amazing, but it can't always be made the way you imagine it. So as we've worked with manufacturing vendors, we quickly realized that. So I want to say we are done with iterations, and I hope just saying that out loud will solidify it. Jessie, my peer here in the cohort, has been phenomenal in supporting me in this, and Aaron and Eamon have really helped to like solidify our relationship as two peers in this cohort. And she's really helped me move 8 steps forward in the engineering and iteration process. And we've had some fun. Last comment, I hear myself going on too long, but we have had some really good fun breaking apart, like taking existing products, breaking them apart, looking at what's inside them and how that might work to make Maya as amazing as it's gonna be.
That's awesome. And I love the collaboration and learning from each other. So Jessie, I'll come to you next. What's been your process so far, and how have you kind of taken, the first step and then the next step and then the next step to get the product to where it is today?
Yeah, Jewel, thank you for that. And thanks for the kind words too, Amberlee. It's been a wild ride for product development. Like, everyone says hardware is hard, but like no one really goes into how hard it really is. But so when I first started off, like I have this cigar box, and thank you, Cindy, for pointing that out, of just like our prototype evolution throughout the years. It started off with a piece of Model Magic clay that I would go around and just be like, hey, like, what would you do if you had this mouth guard that could tell you if you had impact, sustained a dangerous impact? And then I realized like, okay, that was my skill set that I had at the moment. Went back to school, tried learning design classes, and I learned how to like 3D print. And I'm like, all right, how do we detect impacts without electronics? So a lot of the iteration was, your brain moves inside your skull and it moves independently. So maybe it's like this spiky ball that would break a barrier, like your brain is breaking the cerebral spinal fluid barrier. So then we kept coming up with like different iterations, like some with magnets, ended up with our spring design. But our biggest hurdle was when we needed to go from 3D printing to injection molding. So since our device is mechanical, the tolerancing on the manufactured parts is really critical into how accurate it works. So the only way that we could really test how good it was if we had production parts. So we got quotes for injection molding. They were coming out for tens of thousands of dollars, couldn't afford it. So instead, our team purchased an unworking injection molding machine, refurbished it for like $1,000, and we taught ourselves how to injection mold and actually manufacture our own product over time. So that was this version of the product, which kind of looks like a battery. And that's what we launched our Kickstarter with. So that's how we were able to launch our company. And it's evolved. We got feedback from our user that it looked like a battery. So that's where we ended up today with the product. So that took several years in terms of development. But I'm so happy we went down this wild ride, because now we have experience in manufacturing and design, and I'm happy to help people in that, because I know it's a hard process, and we're kind of at like, we're finally selling this product. So the product is finally done, and it's really nice to get to the starting line and have like a supply chain set up.
Jessie, that is so incredible. When they say, talk about scrappiness in entrepreneurs, what you just described, like that is the definition of scrappiness. So congratulations on having that wild ride, that roller coaster, but making it to the point now where you are in the market. And people in the chat want to know, how do they get one? So make sure you let them know where to buy one. Okay.
Yeah. Can I make a quick plug? I was like, you could go to Tizuda.com, and we're actually doing a promo for tonight. So if you use the promo code LaunchLane, you'll get 30% off your first order. So I'll put that in the chat.
Amazing. And just so that we know how we can be supporting you, and everyone, I'm gonna ask this question of everyone before we end up in the chat. But Jessie, for you, who is like the target customer? What are your channels where you're selling? Let us know all of that so we can be making connections in our mind.
Absolutely. So we are selling direct to consumer right now through our website. We are looking for wholesale partnership opportunities. We are working with helmet manufacturers themselves, integrating our technology into theirs. And we do have retail capabilities. So we're looking for distributors who service the sports or construction industry, because it attaches to, team helmets, bike helmets, as well as hard hats. So if you use a helmet, this is applicable to you.
Amazing. Y'all are an impressive group. Wow. Tywanna, I want to come to you next. What's been your process? And I love what you said about you couldn't find it, so you made it. So talk to us about, how did you get that first version, and how have you been able to iterate since then?
Well, and thank you so much. I want to say thank you for hosting the panel. This is my first panel, so thank you very much for your patience. But sit back, I love talking about my product. So, well, like I said, I saw her coughing and thought, okay, I can go online. And Jerry, sorry, my cat doesn't know the word no. Sorry. I saw her coughing. I went home and literally went online. I knew there were suction devices. My mother-in-law at the time had a trach. So I knew there were suction devices, but they were so big and bulky. And I thought, oh, I can jerry-rig something together and make it battery operated. And when I couldn't find it, I said, okay, Friday night sometimes for my husband and I, or a big box store date nights, we can be in a big box store for hours, just figuring out kind of how to do things. Went in the camping department, and the battery operated, suction, the thing you blow up your air mattress with. Well, on top of that, there's a deflation. So I said, okay, I'm thinking I can make this work. Went and got that. I tried first with a breast pump. I bought a breast pump first and thought, okay, well, put it together, but you couldn't do it the right. That suction, the intervals were not strong enough. Then I found the camping and the battery operated thing. Found the camping equipment, some baby bottles from the dollar store, and lots of clear plastic tubing. And we were able to put together a suction device that was so crude. We had to hide it in the back of her wheelchair. And then we brought the bottle up and hid that in a big gulp cup. And so so people didn't have to look at the saliva coming out. And she has one hand, so she'd have to cut it on in the back of her thing. Like I said, it sounds like a lawnmower starting up, and bring the tube to her mouth and then suction out her mouth. We pinned the tube to her mouth, to her lapel, and bring the tube to her mouth and suction out. And the sound wasn't pleasant either. So other people in the restaurant, you can kind of see them like, ugh. We would always ask them, sit us way, way in the back because it's going to be really loud. But like I said, it worked. She was able to eat a rare steak and not get drool on her chest. She was happy. I was happy. But literally, this sat dormant for years because I just didn't have the resources, and it was on my one-day list to do. And then I found accelerator programs. But that first one, and now, sorry, I'm excited about it. Now it is a one single unit with a waste disposal. Sorry, I'm sorry. A waste reservoir that can be removed with one hand. When she picks it up, it comes on. When she puts it down, it goes off. And that was the dream come true, that everything can be in one unit. And I have to say thank you to this wonderful group, because any question that I had about anything, they just came to my rescue. And now I have a viable product to get out. Well, I don't have it yet. We're still building the beta. So.
But you will soon.
I will soon.
Yes. That is so awesome. Rob, I want to switch gears a little bit and come to you. So one of the things that I'm picking up in the stories is around funding. You all were delicate in how you said it, but a lot of the reasons and the ways in which you did the things you did were the underlying point was around funding. So I'm curious for you, and I'll ask a few other people about this. What's been your funding path for your business, and how has that really, either helped or made it a little longer?
That's an interesting question. Our funding path, we were primarily self-funded. We took our time with this because we were dealing with safety and wellness issues, and we wanted to get things right. And it took us a little bit of time to really think through how we want to approach solving this problem of generating the behavioral data from the home. And so it took us a couple of iterations to develop the algorithms, and we weren't building physical products, thankfully. We're using the Silicon Valley game plan, which is put as much of this into software as you can because it's a lot cheaper to keep iterating. And products, quite frankly, will come and go, and so that's how we've approached it. However, as we began to grow and we realized that we need to step on the accelerator a little bit and be able to build some traction, it was really, we began to look at external sources, and we were so fortunate enough that the timing was perfect, where we were able to get involved with Launch Lane and the accelerator, and it was just a great partnership. The sweet spot around digital health and what we were doing, and being part of the ecosystem here in Philly that Brigitte has talked about earlier, was just right on target for us. We knew we were really onto something when we put our system in one of our pilot homes, and I got a call one morning that said, "Thank you, you saved my dad's life." He had tried to leave his home in the middle of a giant snowstorm here in the Northeast. And it was right around the whole time frame when we were getting going and thinking about how to accelerate in our funding and capital need strategy. So our funding has been, largely self-funded, but with a big boost from Launch Lane, and that's been really terrific for us. We've been able to develop relationships now and partnerships with home care agencies across the country, and we're just really getting rocking and rolling, and it's just an exciting time.
That's incredible, and I think people discount the importance of kind of slow rolling it a little bit and figuring things out on the front end and maybe putting your own capital to work while you do that. So I appreciate you sharing that. I wanted to double click in on something you mentioned, behavioral health, or behavioral data, I should say. Tell us a little bit more about that for those of us who don't really know what that means, like me.
Yeah, behavioral data is, it's probably one of the most overlooked aspects of in our healthcare system today. And most people think about behavioral data in terms of mental health, but we're talking about, what people are actually doing. It's really about the idea of objectively, remotely, continuously measuring what people are doing and making observations, both about events, trends, and patterns. And so let me give you two quick stories to really bring this home. We had one of our clients, we don't call them patients. We typically don't call them patients. We call them either care recipients or clients. This was a relatively young man in his early 60s who was suffering from dementia, and his family didn't know if it was safe for him to live in his home, because when they're not there, you don't know what's going on. And while he did have the support of an aide from 8 a.m. to 10 p.m., the question is what's really happening at night when no one's there? And within just a few days, they were able to learn so much about this individual's patterns, his behaviors, really, that they were able to decide, well, they learned, quite frankly, that he was confusing his front door with other doors in the house, and it became a real safety risk. And then as it turned out, he was actually leaving the home. And so without our technology and our service and our system, they would have no idea that this individual was engaging in this risky behavior. And you can extend it to other behaviors in the home. For example, people whose bathroom frequency changes at night. It's one thing to get up once or twice a night. When you get up in age, that happens. But if that certainly changes to 4 or 5 times a night, that could be an indication of a UTI or other issues that people may have. And we've helped families with those understand that the behavior is really indicative of an underlying health issue. And with our data, they're able to go see a doctor and have those be tested to see if there are any underlying health conditions like a UTI, which we found, and we're able to keep somebody, out of the hospital. So it's been very exciting. So those are the kinds of behaviors we're talking about, behaviors that relate to safety and wellness that people do when they're alone. And quite frankly, seniors are alone 20 hours a day. And in today's pandemic world, they're often alone for days on end. And so when you're not there, you just don't know what's going on. And we just take away all of those blind spots through the idea of looking at the behavioral data.
Rob, one more question for you, because some of the things you said sparked my curiosity around how do people, let's just say me, I'm a granddaughter, my grandmother is exhibiting early signs of dementia, and I'm worried about her, but I can't be there with her right now because of COVID. What ways could I engage potentially Envoy to kind of be eyes and ears and track the data of what's happening with her? Is that possible?
Yeah, it's absolutely possible, and that's exactly what we do. Through our Care Insights, we've aligned this behavioral data very clinically with the help of our team, who's very clinically who's clinically trained. Our head of product is a nurse associated with Penn Medicine, and they've really been helping us to really think about what we're doing from a clinical point of view. So if you go to envoyathome.com, a shameless plug for me as well, and reach out to me, click on one of those links and send me a note. We will look to pair you with one of our partners to hopefully be able to support your caregiving needs. We've been getting a lot of inbound leads, frankly. And so what we're doing is we're taking those inbound leads, going to home care agencies in the areas where we don't have partners yet, and looking to foster and jumpstart that relationship. So it's been great. And thank you for that question.
You all are solving all my problems tonight.
Well, that's what we're here for. So we would love to solve your problems. That's what we want to do.
I really appreciate it. Brandon, I'm going to come to you next. Can you talk to us about, talk about the growth plan for ARC? What are you thinking about as far as how do you get more people, and what does that look like over the next year or so?
That's a great question. Well, first, I just want to mention that 911 call volumes in COVID are not going down. They're actually going up. I don't have the latest, but at some point in late June or July, call volumes in New York were up 40%. And so this is just a crazy time for people who are literally putting their lives on the line, responding to people's homes who they don't even know if the person has COVID or was exposed to it, and they're still running into the house to help. So our growth plan is really the grassroots approach. If anybody knows us, that's great. But just for those who don't, we actually live in the centroid of the highest concentration of first responders in the nation. 15% of the nation's fire departments are in a 5-hour drive from Philly. So we plan on launching this with some of our beta partners in South Jersey, as well as we're looking into actually offering a similar product to our nation's military deployed here in the US. There's 60 Air Force bases, and each one of those has a tarmac, and each one of those tarmacs needs firefighters and EMTs and emergency first responders. So we have a lot of irons in the fire, if you will, and a lot of first responders that are asking for the technology. Now our task is to make sure that the product that we put out there aligns well with their needs, and we don't give them something else to do. We actually give them the tool that they can consume the information they need and then put it down and continue with their job.
Great. And do you see yourself going to these sort of individual, firefighters, or are you going to cities, or how are you thinking about how you actually get these people?
Yeah, so part of what makes this such a hard problem to solve for everybody is the fact that the 911 system is, for all intents and purposes, broken in the US. And it's not because the people are broken, it's because the tools that we've given them to collect, consume, and share data are broken. And so we don't want to go to the individual first responder to make the sale or to translate this solution. We go to the fire chief, the police chief, the EMS chief. And then there's actually a higher level, which is called your Office of Emergency Management. And there's town levels, city level, but there's also county level. So one example, we've met with the Gloucester County Office of Emergency Management, who see great promise in this technology. We've been working with them over the past year and a half. And they actually oversee 75 departments in their area, all adopting the same standard operating procedures, because when there's a 4 or 5 alarm fire, they all respond together. So they need a collective common operating picture to work together. And that's part of the value of this platform, is connecting departments to each other and then connecting people within the departments themselves.
Awesome. So the people that you want to talk to are the police chiefs, the fire chiefs, decision makers at that level?
Yeah, so if anybody knows any first responders, please do connect us. We're always happy to talk to them. Every time we hear a story, it helps make the product better. And that's our big ask of everybody tonight. If you are a first responder, thank you. And if you know a first responder, please connect us.
Great. I'm trying to slide those asks in there, if you can notice my questions. Crystal, I am super curious. First of all, congratulations on closing your pre-seed. Is that right?
Yeah.
Yeah, so congrats on that. Tell me about what that's looked like to raise money. I'm assuming most of that you raised in the midst of the pandemic. And then also, I want to dive a little bit deeper in your rebrand, because that's obviously a big undertaking as well. So talk to us about those two things.
Right. So thank you very much, Jewel. So yes, it has been a crazy, crazy time in COVID just for all of us, and we can all attest to that throughout the cohort around like pitching to investors in a crazy pandemic, trying to iterate on your product, trying to even create a product that's relevant to what's going on in the world right now, right? A lot of us had to pivot and make major changes. Like I said, back when we met, we were Clit Health, and at the time we had not raised any money. We were doing purely pitch competitions, so getting as much free money as possible. So we ended up raising about $100,000 in non-dilutive capital from pitch competitions. And then the very first actual investor check that we got was from Launchline. So fun fact, the day I left Boston from Harvard, I actually flew directly to Launchline for the first day of our cohort. So that's the day I met everyone. Wow. That's kind of like a fun fact there. So anyway, so through that process, like during, the cohort, what had happened was everyone collectively as a cohort, we started all talking about how do we change what we're doing? How do we create products that are relevant, like I said, and how do we do things that will really change the world in a pandemic? And that kind of led myself to, deciding, okay, well, we're going from purely gynecology to more like, primary healthcare as well as mental health care. So we had to create something that was geared specifically towards that need around, holistic healthcare versus just like gynecology. So that's largely the reason why we changed it. And it's still like, Clit Health was my baby, so it kind of still hurts, but happy about, growth and change and everything that we've done. So yes, after getting that first check, and I also always would like to say this about Launchline, through that process, we did our first real due diligence, and that allowed everything that kind of happened after with all the other investors we started talking to, and then, talking to the cohort, getting feedback from everyone that's on here around like our messaging and things like that, led us to getting a next check and a next check. And now, we're officially over $1 million in our fundraise. So this is very, different from what we had expected as a company. But what has happened now, and this is important for, everyone here, is, healthcare has been shown to be very, very crucial and needed in this time. And every single one of us has been fortunate to, grow what we're doing and make an impact in the lives of people. So that has been really great with COVID. So, between the fundraising and the iteration and the changing and the entire rebrand, it's been wild, but, it's been a great run. A lot of what we're doing now is specifically around, selling to colleges and universities. So prior to converting over to Kira, we were more of a direct consumer company, where folks could just go on and text a doctor and answer a question that they had. But now, we're working with colleges because what we found was, the place where we would find the concentration of young people who needed the most care, who didn't have access, was through colleges, right? And a lot of what we've seen is, as you all might know, colleges are going through, everything around COVID right now, thinking about how do we keep our students in school? How do we manage their health and things like that? And what we're also finding is, these students are ending up paying, for their healthcare and still having to, have coverage, so to speak, but they're not able to receive the care from their campus health center because, one, they're not equipped for it. And also, they're trying to limit the amount of, touch or whatever, as far as like going into a health center. So that's kind of where we've come in as Kira Health to support colleges and universities. What we're doing, and we're excited about this in the next year, is we're working with 4 major universities next year, potentially getting us to work with about 30,000 students. So that is a huge, huge milestone for us in terms of being able to impact change. So yeah, a lot has happened, but a lot of good things. So
that is so, so impressive. And congratulations on being able to thing I have to say congratulations on is sometimes as a founder, you get really, really tied to certain aspects of your business, get like the name or, you know, the brand. So it could be really challenging to let certain things go and make decisions where, you know, it's the best decision for the business, but it can be tough personally. So kudos to you for doing that. And I think it will be in the long run. I think you made the right decision. So, and again, congratulations on all the progress since we met. It's really, really amazing to see. Burak, I want to come to you next. I have a couple questions for you. So what you're working on is, as you noted in your intro, it evokes a lot of emotion. And I can say this, like I mentioned, I'm experiencing it right now. So I'm curious about how you were thinking about all of what is tied up with people as it relates to fertility, and how do you address that as you are going to market and trying to help folks? And a lot of it has to do with shame. So can you speak to that a little bit?
Yeah, I think it's a really a tough point for a lot of companies. I mean, a lot of companies from like approaching the people, because you know, the bottleneck is the clinics, right? So you have to convince clinics as the customers, and the benefit you know, will be on the couples. But then, so if they want to keep the couples coming in, more cycles, more money for them. But then our idea is to shorten the, you know, the process, then less cycles needed, and they can increase the live birth rates. But so our goal is to lift the burden mostly on the women, because what happens, they select the wrong sperm. That's the problem. It's actually really simple, but what happens, like, you know, they analyze it, they look at it, but since it's already exposed, they put in the garbage, and then they take a new sample. So there's no guarantee that the one they look, it's the one that they're going to be using. You know, like in the software development, they have these WYSIWYG editors. What you see is what you get. In the IVF procedures, it's the opposite of it. It's just like a random pick. So, and then that costs women 4 months if they select the wrong one, because then they will start everything. So we try to explain this, that less cycles will be, there will be less cycles for the couple, so they don't have to suffer for 2 years. But then the clinics, how they're going to make money from this, we have to balance it. So then they will have more patients. So then the patient volume will increase, and they don't have to have waiting list for the top couples to come in. And of course, their performance, the ratings will go up, because what happens, the couples go online, they look for, you know, the best IVF clinics, top rated, you know, the blogs and so on. So what we want to reach, actually bypassing the clinics and talking to the couples, okay, here's the technology. Of course, it's clinically proven, and then the evidence based, and then it will help you. And then basically talk to your doctor or the clinician to, you know, or select the clinic which has our system. It is a long term, of course. It's half of the puzzle. It takes two to tango. You know, one is sperm, one is egg. So it's not everything. But again, we can make a snapshot fix of the procedure. So then we can focus on the development of the embryo all the way to the pregnancy, and after that the healthy the childhood. Because if they select the wrong sperm, it affects the early childhood in terms of the neurodevelopment of the infant. So that's the idea, but it's a long journey for us to explain this to the couples. And speaking as a scientist, of course, it's more difficult. Yeah.
Yeah. So if I had not moderated this panel tonight, how would I have known about you? How are you reaching couples?
Oh, yes. So I think at the moment we wouldn't be able to, because we need to go through the FDA clearance. We need to have this 510K clearance to make sure that it's safe to use. It's clinically proven. We have lots of data, because we also have a deep learning algorithms. So the AI in it, so it just makes it more complicated. So we want to make sure that it's a robust system, it's safe to use, and it is actually what we claim. So at the moment, you won't be able to hear about us, but in a few months, you might be starting actually hearing about us. What we do is with Resolve and several other foundations and fertility networks, we introduce ourselves to them that basically these are the networks of a lot of members. So they have access to those people. I think in the near future, we will be writing the blog posts. So not really scientific, but then the citizens can understand. So so that's the next step.
Amazing. I'm going to set up my Google alerts so that I can get the news about things when you're live. So thank you for that. We are coming towards the end of our time. I want to make sure that folks in the audience have a chance to submit and ask any questions. While people get their questions ready, Crystal, you left out a very important part of your life. Tell us more.
So someone had mentioned in the chat, I actually got married in the pandemic in my living room. That's one important part of my life. And thank you. And I guess what part specifically, Jewel?
That was really it. I just was like, you told me all the deets as far as what's happened since I last saw you, and you left that part out. So that.
Oh yeah, no, for sure. And he also mentioned this. I also got listed on Forbes 30 under 30 last week. So milestone.
Yeah. Congrats.
So exciting this happened. Yeah, thank you.
Yes. I love that you all are having so many great wins, and I want to give other folks the chance to do a little bragging about what's happened, where some spotlights or wins that have happened over the last few days, because last few months, I should say. Someone mentioned about silver linings, and I think in the time that we're in, it's all we have. So it's good to be able to celebrate. So does anyone else have anything you want to share? Little spotlight brag moment. Anyone?
I received we were invited to apply to the Pennsylvania Pediatric Medical Device Consortium in October, and we found out we are receiving the grant this year. So now I've raised $100,000 in 1 year.
Nice.
Yay.
Amazing. Congratulations.
Nice.
Thank you.
This is Rich. We provide a service to caregivers that helps them around coaching and dealing with the challenge of caregiving. And we had a caregiver last week that, in looking at the data, we saw a client who was starting to sundown, and we suggested to him Cincinnati or the St. Louis slums instrument, and he did it. It's a lay tool, and the man was like a 13 out of 30 or 17 out of 30. So he's got an appointment with his neurologist, and the hope is that if he'll be properly diagnosed, and that we can coach the caregiver around dealing with whatever type of dementia is there, and in that way, improve both caregiver stress and outcomes for this man.
Amazing. Rich, I can't see you, but I heard you, so thank you for that. Anyone else have anything to share? I think there's a few questions to come in the chat, so I'll go back if no one else has.
If I could say a couple things, this is in my new role as the VP, but before I was the VP, I was the director of this program, and still am the director of this program. And I have to say that I'm just really, really impressed with this team and this group. And you guys have done an amazing job tonight. So thank you. Made me proud.
Yay, great job, everyone.
There are a couple questions. Yep. I can put them out here. One is for Burak, and there's one for Amberlee, and there's one for the panel. So I'll just start with Burak first. Burak, what is the sales process like with the AG industry? That's one question. And I'll mention to I mentioned Amberlee's too. Amberlee, a big value prop for Maya, is it Maya?
Maya,
I'm sorry, Maya was about keeping the temp on the move. Now with less movement, do you think that would impact? That's actually an interesting question. So Burak, definitely want to start with you on that.
Yeah, Mom. So I haven't mentioned in the pitch, but so our technology can separate the female sperm from male sperm. So basically, half of the sperm are female and half of them are male. So in bull market, in dairy production, still, I mean, you know, I know the vegetarians and vegans, but the milk production is just feeding the world still. It's a really big market, and it's very important to have the females only, not because if they have the male cows, then they kill them or they ship it to somewhere else. So basically, in order to have a milk production, they need to select females, and then each male costs money. So we have a success rate of 85%. It's not industrially there yet, but it's non-invasive, so we don't harm, and ours is cheaper. So I think we have a big market opportunity there. And we did one pilot with the largest customer, actually, in August. Yes.
Thank you. Amberlee.
Sure. Yeah. I think that's a great question. The pandemic has really made us rethink about who our customer is. You know, it's not as obvious as breastfeeding and pumping moms. You have to kind of do market segmentation and really look at the consumer and their behaviors and why they would need a Maya. So the pandemic has really reminded us I think the whole world really, the importance of essential workers. So whether that's social workers still going out in the field, doctors, grocery store workers, restaurant workers, whoever that is still going. The world didn't stop when the pandemic started. Right. You know, right. People still have to go to work and they still have to store their breast milk. And, you know, we've heard a lot of more anecdotal stories about like RN nurses, for example, that they can't store their breast milk in the fridges at the hospital because it's only for, you know, medical purposes. So having ownership of how they are storing and cooling their breast milk is super important. So we've really tried to target that audience more, and will be when we're launching in 2021.
Nice. Well, Jewel, you were a natural. You are amazing. Thank you so much for just being here, sharing your expertise and your magic and your just spirit with this group who are really just phenomenal entrepreneurs. To have the opportunity to have you monitor this panel was amazing. And I'm going to turn it over to you one last time, because I think there's something else that we have to do before we let you go, because I know you definitely still on a time crunch too. But before I say that, one thing, launch lane applications for cohort 2. If you want to be where these entrepreneurs are, scalable, ready, impactful growth in digital health, applications are due December 21st. We've extended it. It's a great opportunity. You see here, this is what we do, folks. We are in live in color, changing lives here, changing the world. So if you want to join our next year for the cohort, please, there's a link in the chat. Apply cohort 2. We're ready for you. And we're very excited for what comes, because 2021 has a lot to offer for sure.
I just have to say, people that are on the fence about signing up for accelerator programs, I'm an executive assistant. I'm not MBA. I don't have an engineering background. And here I am. And the year of the pandemic, I've raised $100,000. Right. And that was because I've been in this group. So, and it can be taught. So if you're on the edge, sign up. It's free. It doesn't cost you anything. So that was my plug. Sorry.
Amberlee, you want to say something real quick, or?
Oh, no, I was just saying thank you so much, Jewel, for being such a great host and just moving through the questions beautifully.
Thank you.
Thank you. This is not my day job, but you know. I really appreciate the opportunity. It's been amazing hearing from all of you and hearing about your businesses. And literally I have like 5 tabs open so that I can go and do more research and become your customers. I want to make sure everyone, I saw a few people do it, but make sure you put your links, how people can follow you, how they can support you, what you need. This is the opportunity to do that. So make sure you put that in the chat so all of the 83 participants can see it. Yes, this is the time. So again, congratulations, you all. What you've accomplished, I want to say this one more time, what you've been able to accomplish in what will go down as the craziest year of any of our lives is just incredible. So I just want to give hats off to you again for your work and the fact that each and every one of you are doing literally life-saving work. So it's just incredible. So my last to do as the moderator of this panel is to announce the winner of the most engaging video. Can I get a drum roll, please? Tezuda!
Woo! Yay!
Congratulations, Jessie.
Nice, Jessie.
Appreciate it. Lots of fun on Premiere with that. But I just wanted to thank everyone for tonight. This was such a great event. Thank you for putting it together, and definitely apply to Launch Lane. It was my silver lining during COVID. So highly recommend it.
Thank you.
I would add to that as well. That was really, it had another silver lining, and it kept a lot of us sane through this pandemic. It was kudos to Aaron and Eamon for really understanding the needs of the entrepreneur from the perspective of being in isolation in a pandemic.
Absolutely. Everyone became family. Jewel, you're now our pseudo Launch Lane family. Anytime you want to come to Philadelphia, anytime you want to visit the cohort, visit the Science Center, you have a red carpet. Seriously, you have a red carpet here anytime for you.
As soon as we can get back out there, I am there. So don't forget about me.
Absolutely. Well, thank you all for joining us for our panel number 2 for the Launch Lane cohort, moderated by the Burks Solomon. We're now going to break for our last intermission. A couple housekeeping one more time. The Remo platform is now open. We're going to open it up for everyone to go to visit the cohort. They are actually going to have their own tables that if you want to engage them in conversation and any type of question, they're going to be there. So definitely everyone check out the Remo link. It's going to be put in the chat one more time. Feel free to go and mingle and mix. This is kind of virtual mingle and mixing, people. This is 2020. We got to make it in our mind and make it happen, but they will be there. And we'll be back around 7:10-ish, but 7:10 to join Melissa Hanna and State Representative Morgan Cephas, who will be definitely our last but not least of our excellent content that's been going on for this evening. Again, that will be starting around 7:10. So have some time, stretch, use, just take a little bit of a break or go to Remo to visit the Launch Lane crew. And again, if anyone would like to apply to Launch Lane, the link is in the chat for applications that are now extended to December 21st. So we'll see you all in a couple minutes.